Many patients ask me what effects fibroids have on pregnancy. Many patients have fibroids which doesn't have any symptoms and they don't want to do any surgical management of it, and they're planning to get pregnant and they wonder if it would affect the pregnancy or not. This depends on the position, number one, and the size of the fibroids. Usually fibroids are in the outer layer of the uterus, in the endometrium or myometrium, or the serosa, we call the outer layer. If they're on the outer layer, they don't affect the pregnancy, and especially if they're small size. If they are in the inner layer, endometrium lining of a uterus, they could affect getting pregnant. They could cause infertility potentially, depending on the position, and occasionally can cause miscarriage. But in general, I don't recommend taking fibroids out before getting pregnant, and we usually try to see what happens if somebody gets pregnant. The reason because the surgery by itself can affect the quality of the uterus and affect the future pregnancy. But if someone has a very large fibroids, I might recommend a myomectomy before getting pregnant. Although I have many patients who have had big fibroids, 5 or 6 centimeters, and had a successful pregnancy with no consequences and had a normal delivery. Sometimes they require C-section depending on the position of the fibroid. Again, if it's very large and could affect delivery of the baby, we might recommend a C-section in that case.